Okay.
Okay. Shall I start talking? Hi, this is Dr. Vinatha Puli. I am Clinical Director for Obstetrics and Gynaecology at Cuddles, Kondapur branch. Today, we are going to have a discussion on what is assisted vaginal births. When is it done? Is there any problems? How to avoid? Why people get worried about having an assisted vaginal birth? First of all, let us see what is an assisted vaginal birth. So during the process of labor, if birth happens naturally, very spontaneous, no interventions, it's called spontaneous vaginal birth. But when we need to do something to get the baby out faster and we have to help ease out the baby off the birth canal, we call it assisted vaginal birth. How common is it? Because not many people have heard about it. So everyone will ask, is it really happening? Will it happen to me? So it's common only, not as common as cesarean, but those who have a vaginal birth, almost 1 in 8 women might have this assisted vaginal birth. And it is more common between first time moms who are giving birth than second time birthing women. So we can see almost in first time mothers, on 1 in 3 or 4 women only will require assisted vaginal birth. So what are used? What is it that is used to assist a birth? What can you do to assist a birth? People worry about some gadgets or some very fancy equipment that we use to get the baby out, and a lot of anxiety is around. Is it harmful for baby? Is it harmful for mother? So what do we use to assist the birth? We use a soft cup called Ventus cup. I think it's very, very popularized after the movie called Three Idiots. Now everyone knows, okay, it's the one that is used as a cup. Yes, it's made of a plastic or a metal, and it's a soft cup. It uses suction. It's like a syringe, how negative pressure is created. It is similar that it creates that negative pressure, and so the baby can be eased out. Or sometimes we use a metal forceps. It's not like forceps that you to pick the things up. It's a metal instrument that goes and fits around the baby. It's like a cage. So it's very not traumatic. It's not going to be very sharp on baby or anything. It goes fits around the baby's head nicely on the side, and we can have a handle to pull the baby. So these are different types of things that we use to ease the birth. When, why women will require assistance? Why can we not wait for birth to happen naturally? Is sometimes the baby, when baby is coming out of birth canal, can have problems. Right? Baby can get distressed. Heartbeat pattern of the baby can go really down. That we think no, this we have to make it really faster, and we cannot wait for things to happen naturally. So, in some situations, it is not just the baby problem. Mother might have been worn out pushing and pushing for a lot of hours, and they might say that I cannot do it anymore, and or the progress will not happen even though we wait, even though mother is pushing very well, efforts are good, it might just not happen. In very some women, medical conditions might mean that you're not allowed to push much, some heart problems or something like that. Then we feel okay, we cannot allow you to push much. So we have to shorten that pushing stage. Then we might use the assistance. So these are the very few situations where assisted births are required. So what can we do to prevent or reduce our chance of having an assisted vaginal birth? As I said, first time moms are more prone. But what we have observed is those who had good support, that might not need medical support, very emotional support by anyone from their family or an outside person called Tuda or anyone, those who are receiving good emotional support, we have seen that they will require less pain relief, like epidurals or anything in labor, and they are also less likely to have an assisted vaginal birth. So have your support systems ready and being very confident of okay, if you are requiring an epidural, nowadays, the epidurals are also quite advanced. The anesthetic medications that are used in epidural are also very good, and they are not increasing the risk of assisted vaginal birth as how it used to be when epidurals were very early on. So that is also has gone a little better side. And those who are able to be very fit during pregnancy in labor, they can adopt few positions that might encourage the baby to fit in nicely and come down very well. Like those who are able to sit upright and onto the side, able to change positions in advanced labor. That will happen only if they keep that maintenance and fitness during the pregnancies. So then we are able to do these changes, positional changes that can help. So all these can sometimes reduce the chance of you having an assisted vaginal birth. But still, there might be a requirement. And if it is required, what is it that scares us most? Any problems for mother? Any problems for baby? What could be the problems for mother? Mother might experience if they already don't have a good pain relief on board, doing something more than natural might make mother have the perception of pain. So they might be more anxious, something is happening there. So they might feel pain also. And during that process, sometimes the tears can happen during the vaginal birth. So, and when we are doing it with a speed, the tears are more likely to happen. And sometimes the tears can go deep, deep into the motion passage or the muscle around the motion passage, requiring a lot of stitching and going to operation theatre to complete that stitching and things. But not all women who undergo a vaginal delivery or an assisted vaginal delivery should have this problem. If maybe 1 or 2% women after a natural birth have this tear, deep tears, maybe after a forceps or a ventouse, it can increase up to maybe 3 to 4%, but it's still most of the time less than 5%. So 95% of the time, you might get away without having deep tears. So the cause of concern, oh my God, the tears can happen very deep, is very slightly extra. And the next thing is about the baby. Is there any other things that can happen for the baby? Is it safe? Now, as I mentioned before, these instruments are not very sharp. They are gentle on the baby. Like the soft cup is soft. So it's unlikely it causes a major harm. Or even the metal forceps, it goes around the baby to support rather than on the face. That means we have not assessed very well. So if the baby is in the right position, the forceps applied correctly will do less harm for the baby. Very rarely, sometimes problems do happen. Like there can be bleeding in the layers of the skin of scalp of the baby, or can be very much inside in the brain, and that is the main worry of many people who will worry about having an assisted birth. I think when a forceps or the ventricles done correctly, we observe really, really less problems. So the main thing is, okay, how confident is the doctor? How much indicated is that assisted delivery? How correctly we have assessed that woman, the position of the baby, that determines how safe we are to conduct that assisted vaginal delivery. So most of the time, it's a very safe procedure, but we can understand that not everybody are prepared to have an assisted vaginal delivery. What can we make like to do it better? Because when at the long time of labor and we are in a very quick state that you need or require assisted vaginal delivery, it's very hard for women or a couple to make the decision. okay to say yes or no. So because it's there is no enough information or enough time to give that detailed information so they can make an informed choice. So always we encourage the women and the couples to talk about this during their birth plans, during their pregnancies, when they go for childbirth classes, when they meet midwife or their doctor. So we have to make sure that that concept of assisted vaginal birth should be known to them. The possibility should be explained because we might not avoid sometimes the assisted vaginal birth. But still, we see some women very much against. Maybe they had bad experiences in their family or friends, and so they are very much against having an assisted vaginal birth. If you are somebody who are against this vaginal assistance, please talk to your doctor because we need to make plans. Sometimes if it's unavoidable, what should we do? So when we are contemplating to go ahead for a natural birthing process, we have to understand this possibility is there and be prepared for it. And also the duty and the responsibility of the doctor to make sure if they require, definitely they require or not, and how safely and quickly we can do it. Why can we not avoid an assisted vaginal delivery? Is there any alternative? Some people will ask, I will go for a cesarean section no matter what at that stage. Sometimes cesarean section at that late stage is very complicated. It is not like doing a cesarean section in a planned way or when you are in early labor. Sometimes when the baby is so low down and labor has gone for many hours, cervix is completely open, then it is not very straightforward cesarean. So to get the baby out at cesarean, you have to go really down, and the inside tissues with a long labor can be waterlogged and they are very easily prone for tears going everywhere and anywhere. Like how if the paper is soaked in water, it's easy or more likely to tear when we are trying to do anything with that paper than a normal paper which is dry. So a similar concept applies to women in labor for a long time. The inside tissue will tear very easily, can go up and down, and the stitching can become more complicated. Bleeding can happen more than that is required. And getting the baby out is also difficult because baby head is quite down. Although sometimes forceps or ventouse, when it is attempted and when we have to abandon it for safety, we think the baby is going to come but not coming, then it is very important for safety of mother and baby, we should know when to stop. And when we stop it and do a cesarean, we will have lots of measures to or precautions to take care so we can deal with all these complications or make sure those complications are very less. If we have drills and safety measures, and we can reduce this complication rate. And always assisted vaginal births are really going out of the scale of the recent obstetricians. So we encourage all the doctors, the young doctors who are in to the obstetrics, to have lots of workstations and practices so they can become very confident doing this assisted vaginal deliveries. Why should we be doing assisted vaginal deliveries at all? Nowadays, our cesarean rates are going sky high. Whatever we are doing, we are not able to bring down the cesarean section rates. Why? Because many people are not going for assisted vaginal deliveries. Either they are scared or the doctors are scared. So at least that 10 to 15% of women who need assisted deliveries, if they can avoid a cesarean, we can do a lot and we can do a more safe, quick deliveries or births by doing assisted deliveries in that selected group of women. So I think what we will see is if anyone has any questions or anything, we will try and answer for you. Is there anything? No? Okay. So if no questions, I think we keep going. And looking at anything else, like, that we can do to sometimes explain the women about the forceps or the ventricles. So if some people will have the concern, oh my God, if I get assisted vaginal birth this time, will I have a very high chance of having the same in the next pregnancy? If so, how much is my chance? But mind you, if we have an assisted vaginal birth this time, next time you are less likely to meet the assisted vaginal birth. You are more likely to have a very natural, spontaneous birth. So we have observed more than 90% of in the future pregnancy will be fine for vaginal birth. They might not require any assistance. So that's a good sign. And sometimes what we also observe is after the vaginal birth, um, there is lots of emotions and everything. And after the assisted vaginal birth, some people might feel a lot more depressed. They might have lots of future questions and everything. And they might not express it. Sometimes they will not be able to understand also why they had this done. And their anxiety might build up and later can lead to postnatal depression. So the important thing we have to do is the doctor should explain why they had not at that time. Maybe they would have explained, but that might not have all registered. Uh, the mother might not register everything, all the information that was told. So the next day, following day, if we go and tell that why they required this assisted birth, what were the reasons behind it, how it happened, what method did we use, and what pain relief options they have, explanation about the care following the assisted birth, that will imbibe a lot of confidence and preparation for that mother. So they will feel confident and also explaining if they have problems with depression later. So when to come back to them, when to approach the hospital, when to seek help, all this information has to be provided. And if that did not happen, the mother also can ask the doctor and questions. So I think medical legally also, if we have explained, that will do good. For first thing is helping the mother overcome that and not letting them go into that postnatal depression. And second thing is for the doctor. So if everything is a documentation, like everything was explained and told and written, then that helps the doctor also that they will not have to go for courts or anything if there was a problem in future. So this is important for women who undergo the procedure and doctor who does the procedure. Both it will be helpful if we do the debriefing following the procedure. And some women might put off planning of further pregnancy, especially if they had a lot of complications um, or lots of procedures done around birthing time. They might feel that, oh my God, another pregnancy, I cannot see myself going through this. They might experience something what we call as a post-traumatic stress disorder. So if they have this feelings, it is important we identify. If they don't seek help, it is must for the doctor also or the midwife to talk about this when they come for a post pregnancy and post birth checkup, usually done after a few weeks or once things settle down. We call them back and check how they are doing. At that time, we have to encourage if they have questions, if how they are feeling, and so if they experience anything, talking out might help things. For some, that might not be enough. They might need a psychological counseling. So it's important that they know when to approach and we know how to help them. That support groups might also help. So women who had assisted vaginal deliveries might not be very many. So if someone else has the same thing, talking about their experience, talking about their concerns might actually help people. So explaining them, yes, these support groups are available, might be of benefit for few. So always preparation, talking about the possibility of assisted vaginal delivery. in childbirth classes or during your antenatal visits when you come for doctor checkups might make you more prepared, and if this happens, you'll be a bit more prepared and confident to go through that process, and we will be able to assist also better. And the women also might be more confident and might have their urge to push better and more confidence in bringing the baby out very safely. Um, I think that comes to conclusion of most of the things that you need to know about assisted vaginal births, and hopefully we will have some questions. And if there are no questions, should we have a conclusion on this? I'll just check if there are any questions. No more questions left. No? Right. We will connect back again in another live session soon about another topic that interests you. Thank you.